This is Shanna Dethi at the Digital Health Live studio at CES 2018, presented by United Healthcare. I am joined in studio this morning by Adam Kaufman, who's the president and CEO of Canary Health. Welcome.
Thank you. It's a pleasure to be here.
So why don't you tell me a little bit about Canary Health, what they do?
Sure. So we're committed to helping people improve their health. And what that means for us is a really unique way to connect coaching to peer support, to peer coaches, and then layer that into chronic condition management.
So by coaching, are you talking, and chronic condition, are we talking maybe pain? Are we talking weight?
Exactly. So most of our work is in diabetes.
Okay.
Everything from prediabetes and obesity into blood glucose management and the kinds of things that keep people with diabetes from progressing to getting sicker and actually hopefully make them healthier.
Okay, so great. So a lot of it probably does surround food, activity,
Exactly.
and things that none of us really want to do without somebody kind of telling us or helping us along the way, right?
I think you're hitting on it. I think what we find is that too infrequently has healthcare connected your life priorities to the medical outcomes we want. And so it's really simple to say to you, hey, I notice you blood sugar runs high in the afternoon. What are you going to do about it? It's very different to say, we know you're struggling to figure out how to fit this in your life, and let's help you understand what matters. How do you have a conversation with your family, your loved ones? How does this impact the other roles you have? And we find that when we amplify and extend that conversation beyond just that medical issue, we get incredible engagement and incredible outcomes because you're working on what matters to you. And that is almost never your blood sugar is a certain thing or your caloric intake is a certain thing. It's 2 layers or 3 layers past that into your life.
Right. So how does somebody, is it prescribed by your doctor? So how does a patient get connected into Canary Health and into your coaching program?
Yeah. So a participant will never see Canary Health. We're always brought to you by your health plan, your provider organization, sometimes your employer. It doesn't need to be prescribed by the physician, but sometimes they're involved. And our goal is to work inside of healthcare organizations to help them engage their populations.
That's great. So I guess my last question is the delivery method. Is it app, telephone, video?
Yes, and
all of them,
the primary experience is a digital interface, so it can be on your phone. We work with a lot of older populations. They'll still do it on tablets or even on a desktop, but we'll absolutely go by phone. We'll occasionally send print materials, but really the idea is to engage you in our digital experience.
Well, that's great. Well, I think I've learned a lot this morning. Thank you so much,
my pleasure.
Adam.
Thank you.
And this is Shanna Dethi at the Digital Health Live studio at CES 2018, presented by United Healthcare.